PARP inhibitors in breast cancer. PARP. I don't want to give the whole name on it, but let's remember it as PARP inhibitors. Let's talk about that today. This is Dr. Raghav with your Oncocare Advisor. PARP inhibitors are like target therapy. That means you need to have a target for it to be effective. But before we dwell into how it's helpful, let's talk about what is it. Let me break it down for you. So we have to start really from the basic step, which is every cell undergoes damage at some point of time in their life, or at least lots of damages happen in our body on a daily basis. So the damage happens especially in a DNA. That DNA has to be repaired. So let's call it a toolbox. That means you need to have your little pliers and spanners and these kind of things to make sure that you can actually repair that DNA. I would not go into the very much detail, but DNA has two strands. If one strand is broken, there is a mechanism in our body that can help to repair the DNA. But when someone has a BRCA mutation, let's call it BRCA 1 or 2, which leads to breast cancers, it is inherited mutation. That means it runs in the family. It can also happen otherwise, but generally speaking. So when there is BRCA mutation, now you don't have the toolbox to be able to fix that DNA. So what happens in the cancer cell is when there is BRCA mutation and this DNA is broken, it uses something called PARP, an enzyme, to actually do the repair so it can continue to multiply. What PARP inhibitors do is they come and block that enzyme so it does not let the cancer cells repair the DNA. So they cannot multiply, so they suffocate and die. That is the basic mechanism on how PARP inhibitors work. But how are they effective in a clinical situations? Especially let's talk about breast cancer or ovarian cancer. If someone has BRCA mutation or HRD or PALB, these three situations, the PARP inhibitors are very effective, both in early stages as well as late stages of cancer. But how do we find these mutations? That's where the importance of molecular testing or next generation sequencing is very important. Now, let me quickly summarize what we talked about. First, anytime when a cancer is diagnosed, it's important to ask a question, is there any molecular testing or genomic testing that could be helpful to identify any target therapy options? The second step is, once you identify that, identifying which is the best target therapy. If PALB, BRCA, or HRD is abnormal, PARP inhibitors could be one potential option to control the cancer. The third, understanding why PARP inhibitors are helpful in breast cancer or even in ovarian cancer really affects or really helps you to understand why that is being used. So these 3 points, always talk to your doctor, or if you have any other questions, comments, or any topic you want me to cover, please DM us here, subscribe us, and follow for more information on cancer treatments that are changing very quickly. Thank you for your attention.